Getting the first and also every
Anything else to say, Rodman? Okay, there you go.
I know, this is what I do. Good hand. Point 3. Yeah.
Thank you for joining us early this afternoon for our daily briefing. We are actually watching something that's been coming for a long time, 279 days. Some of the doctors and healthcare workers at BJC Memorial receiving the first vaccination here at their hospital. Chairman, it's a historical moment.
It is the beginning of the end for COVID, and these brave workers who've been on the front line for us, every day during this pandemic, they're now leading. They're showing everyone that here's the vaccine, and we're taking it because we want to be there to help protect you should you have to go to the hospital.
And so Dr. Bodeman was the first one we saw there getting it, and some of the other healthcare workers. We're going to watch this, and then in just a few moments, we're going to be joined with St. Elizabeth's. They have some of their doctors that's going to be doing the same thing, and we just wanted to bring this to you early today so we can get this vaccine procedure started. As this young lady pulling up her sleeve and getting ready to get the vaccine. Well, and Chairman, as you can see, more of the healthcare workers there being vaccinated. And like I said, we're joining our daily briefing, day 279, a little early today because this historical moment, as Chairman, you said, that light at the end of the tunnel is even getting brighter.
Everyone's well prepared for this. We've been talking about a possible vaccine now for over 280 days. So this is a day we've all been dreaming of, but obviously people have been working on this. There's quite a process that's going on, a lot of paperwork, a lot of making sure that everything is just right in this process. And it appears it's going very smoothly at the hospital.
Very smoothly, and just thanks to all the staff at the hospital, Mike McManus, and we'll be seeing Patty Fisher from HSHS and the health department, because this has been a logistical nightmare, Sam, as you can well attest to that, on the health department, both St. Clair County, Eastside Health District. This just didn't happen overnight.
It didn't. There was a lot of planning that went into it. Obviously, a lot of cooperation across the state, from Springfield all the way up to Chicago, Illinois Department of Public Health. And I mean, to finally hear that it had arrived in our hospitals today, we were, relieved. Once we found out that it was there, I think relieved is an understatement. That went to excited to be able to start these vaccinations for our frontline healthcare workers as soon as possible.
I know as late as last night I was on the phone with you saying, any word, and we knew it was going to be here by the end of the week, and we was glad to get the call this morning and to be here to bring this to Team St. Clair, as the chairman said, is really exciting, and it's to be the beginning of the end, we hope. So we appreciate you staying with us as we started earlier, and we're going to be joining St. Elizabeth's here momentarily for their doctors and their healthcare workers that have volunteered to be the first at their facility to get the vaccine. And of course, there is a procedure they have to go through. They'll be monitored for, I think, 15 minutes is what it requires for. But we'll be joining the St. Elizabeth's folks here just in a few moments. Okay.
We're gonna switch to St. Elizabeth.
Okay. Yeah. So what a moment! I'll tell you.
It's really something we've been waiting for a long time. I was sorry that Dr. Bodeman's words, the microphone didn't quite work at the beginning. But the hospital, these hospitals, all the hospitals have been such great partners throughout this pandemic. Dr. Bodeman has been on our briefing here, both virtually, and he was sitting here with us at one point. Really a great leader and someone that gave a lot of trusted information early on in this pandemic, when we were all starving for what is this virus and what can it do. And he came here and talked to us in straight out layman's terms and said, here's what I think is going to happen. And really everything that he talked about came to fruition. Right. He knew what it was going to be, and he talked about this day, the day that a vaccine would become available. And he was right there and took this, was the first one at Memorial.
Right.
And man, we're lucky to have a person like that and all of these healthcare workers that have been on the front line here with us during this pandemic.
Well, and I think the interesting part is, and I'm sure he'll be more than willing to come back on our briefing maybe early next week and give an update on any side effects or anything like that. I think that would be really beneficial to Team St. Clair and everybody who just follows us. So I know Mike McManus and Patty Fisher have already said that they would make them available for us. So I think it's just a way of the transparency to keep our citizens informed of what's going on, because there is a lot of questions out there.
Well, you have, now this starts, we've got 260,000 people in St. Clair County alone that are going to be eligible and are going to need this. Some might not want to take it, and that's their choice, but the goal, I believe, is to be able to get to herd immunity that is generated by people getting a vaccine. We're going to need to reach 75 to 80% of the public to be able to get there. So logistically, we've got a ways to go.
Right. And again, like I said, I can't say enough for our healthcare providers, our first responders, We've been getting calls, when are the general public going to be allowed to get the vaccine? There are people out there that's willing to step up and get it. And Sam, you can kind of comment on that. There is a procedure in place, a tier type setup, isn't there?
There is, and that was put together by AICP, which is who the CDC takes guidance from as far as who this vaccine should be going to. Like right now, with the guidance is that no one under the age of 16. They are looking at a pediatric specific vaccine coming out early fall. Right now, they are not recommending any woman that is pregnant and or breastfeeding to take this vaccine as well. They just haven't done enough of case studies with those people in those situations. So obviously 1A is what we're seeing with the hospitals today. That is our frontline healthcare workers. And then it will file down to our first responders, our police, fire, EMS, those that fall into essential worker category, and then down to the general public. So there is a tier system that we will work our way through as quickly as we can. Please be patient with us. It doesn't happen as quickly as you would think. It takes man hours and time to have these vaccine clinics set up and then to get to everyone, because we don't want to vaccinate everyone on the same day. So we have to spread that out and stagger them a little.
And it takes vaccine.
Yes, and that's the key part.
And so the vaccines are rolling out in limited numbers. And what's out is being distributed. And as this rolls out, St. Clair County has acquired the equipment, the freezers, to be able to house the vaccines. Luckily, the hospitals had those freezers that went to 97 degrees below. A little too cold for Budweiser, but perfect for a vaccine. So those are great things to have, and we've got them in the community, and we're going to be ready for that vaccine. But Sam, talk about there's another vaccine that doesn't require those stringent requirements.
Yeah, the vaccine that you saw the healthcare workers taking in the videos before, and what you will see in just a moment with St. Elizabeth, is the Pfizer vaccine. And that has to be kept at negative 80 degrees. So that is extremely cold. That requires dry ice if you don't have the correct kind of cooler that can get down to that temperature. The second vaccine, which is called Moderna, that's what we are hoping to see come out sometime next week. That does not require the ultra cool freezer. That simply has to be held at between 2 and 8 degrees, and that is normal vaccine temperature. So once Moderna has amped up, their production and shipping, that will be a lot easier for a lot of doctors' offices and different medical groups to handle, because it doesn't require the negative 80 freezer, which is not something most offices have.
I think we're getting ready. St. Elizabeth's Hospital, Randy, have we got them ready?
Yeah, looks like it. Let's see if we can get them on here.
Looks like they're here. So we've got Doctors Schaefer, Moss, and McGowan today, I believe, are going to be getting their vaccine.
Hello.
We can hear you.
Can you see us? Can you hear us?
Yes.
Can't see, but I can hear you.
Well, good.
Right.
We don't want you to see us. We want to see you, though.
Okay.
We appreciate what you're doing there.
Whenever you're ready.
No, thank you all.
Thank you.
Okay, so this is Dr. Ross. You want to say who you are and why you're getting the shot today?
So my name is Jimmy Moss, MOSS. I'm one of the ICU doctors here at St. Elizabeth in O'Fallon. The reason I'm getting the vaccine today is for my teammates who are struggling to take care of patients with this disease, me, myself, and my family, but more importantly, all of my patients who have lost their lives because they didn't get this opportunity. So I feel as one of the leaders in this field and one of the leaders at this hospital, it's best to set the example by getting involved, getting this thing under control.
We sure appreciate you doing this.
Thanks for letting me cut in front of everybody in line. I got a sticker.
You get a smiley face.
There's a smiley face with a mask on it.
Yeah.
You didn't even feel a thing.
I did.
Well, that's the good thing. Well, and for those of you who may just be joining us, you're
That's
actually-
great. Thank you.
Thanks,
Thumbs
Doctor.
up to you. Thank you, Doctor.
Thank you,
We
Dr. Moss.
really
Dr. Schaefer.
appreciate it.
For those of you who just are joining us, you're watching some history being made here with some of the first vaccines being made. Dr. Schaefer?
This is Dr. Schaefer. You want to say who you are, Dr. Schaefer?
Yeah. Hey guys.
My name is Jeff Schaefer. I'm the AD director here at St. Elizabeth's in Fallon. I'm getting this vaccine to protect my friends and family, and so we as a society can return to normal.
Thank you, Doctor.
While we have you, Dr. Schaefer, do you want to say anything to the public about when it's available to them?
Yes, I would encourage everyone to get this vaccine. It's a very safe vaccine. It's a very effective vaccine. This is going to be the best end to this pandemic is for all of us to get vaccinated.
Did you have any hesitancy, Doctor?
Not a bit. I'm happy to be first in line.
Well, and we've had Dr. Schaefer on our briefing with us a couple of different times,
Yes.
and has helped us throughout these 279 days of helping get the word out. And it's great that he stepped up to the plate to be one of the first.
These are true leaders in our community. These are the people on the front line.
And while we're waiting for Dr. Schaefer to get his vaccine, we've talked about it briefly before, but the bank that is right next to the driver's license facility in downtown Belleville and out at St. Clair Square, where they have testing now, those will be two of our locations for our general public to get the vaccine when it becomes available.
Okay.
And there will be a new
There
sign.
you go. You got it.
Thank you, Doctor.
You're quite welcome.
We appreciate it.
You didn't even make a face or anything.
Yeah. And Sam, now the second dose is administered in 21 to 28 days.
That is correct. That is correct, yes.
So,
So when you come to whatever facility you're going to get your vaccine at, you'll get a vaccine card that says this is the date you got your first one, and this is when you need to come back for your second.
okay.
And this is Dr. McGowan.
And we have Dr. Peyton McGowan. Doctor, would you just say where you are located, where you work in the hospital, and anything else you want to say?
Sure. I'm Peyton McGowan. I'm a hospitalist. I'm the medical director for the HSHS hospitalist. I'm getting my vaccine to protect myself, my loved ones, and my patients, and most importantly, to help break down numbers so all of society can get back to fully functional.
Thank you, Doctor. We appreciate your leadership. Did you have any hesitancy to come in and get your vaccine today?
Not at all. We've been so excited, and we've been waiting on these all week, so we're just so happy to be here.
Well, we're happy that you're part of the community, and we appreciate your leadership.
Thank you.
So then, Sam, these individuals will then have to come back in.
Correct, between 21 and 28 days for their second round.
And then the second round, after that, then they will have the immunity that's been promised.
That is correct.
Well, that's
That's
great.
great news, I'll tell you. Yeah, she's sitting there patiently waiting.
So Sam, explain then that, so some of the vaccines will go, like the Moderna, that doesn't need the real freezing temperatures, that will be perhaps sent to other, that will be sent to offices that can handle that. So
That is correct.
it could be the vaccine that you get is the one that is best suited for the environment where you get your vaccine.
That is correct. So some doctors' offices, most likely doctors' offices will get the Moderna because that only requires normal vaccine temperatures. But something important to keep in mind, if your first shot is a Pfizer vaccine, your second shot has to be a Pfizer vaccine as well. So whatever your first dose is, second has to be the same.
Okay, how was it?
And Dr. McGowan is done with her vaccine. Do you have anything else you want to say to the public?
Don't hesitate to get it. All we can do is have as many people vaccinated as possible to get through this. We've already had several people vaccinated at our other facilities yesterday and today, and so far, no ill effects, very safe vaccine.
Thank you,
Very
Doctor.
good.
This is great. We appreciate the leadership and coming out and showing everyone that you're leading by example.
Thank you.
Thank you.
Thank you.
Thanks, Dr. McGowan. We will turn off screen sharing.
Well, Herb, that is great.
Great.
Great news.
That was the last one, but I tell you, it was part, and I'm so glad that those of you who have joined in today, and those of you who may be at work, when you tune in tonight, you'll see what was happening here as we, on day 279, the first vaccine arrived in St. Clair County, and thanks to our good friends at BJC and St. Elizabeth's HSHS had the staff step up to the plate, and just really great, I tell you.
Mike McManus and Patty Fisher.
Oh, they've been team players, part of Team St. Clair, and can't say enough for them. But we got other business that we got to take care of, even though I'm so excited
I
about
know.
this. It's just,
It's been
it's
a
kind
long
of like
time
we've been
coming,
waiting,
and-
and even though
Yeah.
the vaccine's here, we still have numbers we have to give, and
That is
we're
true.
not out of, just because we have this doesn't mean we can stop.
Correct. Yeah, we still have to keep moving forward with what we have proven works, which is, wearing our masks, continuing to wash our hands, and watching our distance. And I think it's even more important now than it was before, simply because one of the biggest holidays of the year is coming up, which is Christmas. And Christmas is all about family and spending time together. And this year that just might look a little different.
Yes.
And we are all feeling that. We are practicing what we preach, and we know that that is something hard to ask families this time of year, but in the end, it will all pay off.
And the message that we get today is that there's light at the end of this tunnel.
There is.
So you saw it today. And so if you delay Christmas several months until we get the kind of immunity in the community that we need to get the numbers low, you have something to look forward to. It isn't that Christmas will be canceled. It just might be postponed with family members a little bit.
And luckily, we have great technology right now that, even though we can't be in the same house, we can be on Skype, we can be on Zoom and on FaceTime to see loved ones open the presents that are sent, and, perhaps for little kids to see what Santa has left them under the tree on Christmas morning. So we are lucky in that fact that we still have ways that we can see our families on the holidays.
We just saw 7 doctors get
Exactly.
get a vaccine. So
Exactly.
If that's possible, anything's possible.
Yes. So as of today, we have tested 188,558 St. Clair County residents, and we have 18,764 that are positive, which is an increase of 224 from yesterday. And that does include both males and females from under the age of 1 up to their 100s. Today, our daily county positivity rate is 11.7%, so a little better than yesterday. And we are at 169,794 negative test results. Unfortunately, we are announcing an additional death today, which brings St. Clair County's total to 294. And that was a man in his 80s who had unknown health conditions. And as always, our sympathies go out to his family. For those who have completed the IDPH required 10-day isolation period, we are at 16,390. For state totals, 12,147,303 have been tested, and we have 879,428 positive test results, which is an increase of 8,828 from yesterday. And for deaths, the state is reporting 14,835, which is an increase of 181 from yesterday. For St. Clair County hospitalization numbers, currently we have 108 patients that are admitted due to COVID-related reasons, and 10 of them are on ventilators. And regionally, we have 226 patients that are admitted due to COVID-related reasons, and 21 of them are on ventilators. For our congregate living facilities that are currently or previously have been in outbreak status, these are cumulative numbers, and please remember we will only announce any facilities that have had any changes. Caritas Family Solutions in Belleville has 61 cases and no deaths, and that is an increase of 2 cases for that facility. Cedar Ridge of Lebanon has 142 cases and 19 deaths, and that is an increase of 1 case for that facility. Freeburg Care Center has 30 cases and no deaths, and that is an increase of 7 cases for that facility. Four Fountains has 118 cases and 29 deaths. That is an increase of 1 case. Lebanon Care Center has 84 cases and 12 deaths, and that is an increase of 2 cases. Mercy Rehab and Care Center in Swansea has 66 cases and no deaths. That is an increase of 3 cases. St. Paul's in Belleville has 122 cases and 17 deaths, and that is an increase of 1 case. And finally, Willow Creek in Belleville has 10 cases and no deaths, and that is an increase of 3 cases. We do still have some testing available this week. Sunday, December 20th at New Life Church in O'Fallon from 8 a.m. to 4 p.m. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. The hospitalization's high today.
They are.
Highest since November 20th. So while the numbers, are at least trending or leveling out, the hospitalizations are concerning. That's a big number.
That's always been a red flag for us. If we see those hospitalizations start to go up, we're going to be watching even more closely. But, that just proves that, with our county positivity rate going down, we still have to continue to do everything right.
I think the highest we ever were is 109. So we're pretty close to that.
We are.
To that record level. So we got to keep that low. And then, of course, 10 on ventilators. That double-digit ventilators is a
We
number
never like to see that.
We don't. So our prayers go out to those that are in the hospital, and certainly for the family of the person who passed away. That these are awful times. We got things that we can be positive about, but we certainly have to realize we are still in the middle of this situation, and there are dark days that are going to be left during this pandemic. We'll move into the zip code report. In 62201, we're up 3 today to 440. 62203, up 4 to 473. 62204, up 4 to 306. 62205, up 10 to 467. 62206, up 3 to 911. 62207, down 1 to 425. 62208, up 16 to 1,067. 62220, up 15 to 1,300. 62221, up 32 to 1,758. 62223, up 15 to 1,130. 62226, up 18 to 2,014. So 62226 broke the 2,000 mark today with an increase of 18. 62232, up 10 to 620. 62239, up 3 to 278. 62240, up 1 to 94. 62243, up 10 to 426. 62254 is up 5 to 577. 62257, up 4 to 205. 62258, up 4 to 687. 62260, up 9 to 472. 62264, up 5 to 220. 62269, up 28 today to 19,990. 62285 is up 6 to 367, and 62289 is up 1 to 30. Sam said 224 new positives today, 1,917 tested. That brings our daily county positivity to 11.7% today, which brings our rolling average to the same as it was yesterday at 10.7%. Our regional positivity today is down to 12%. Remember, our goal is to get below 6.5%, so we have a ways to go with our regional positivity. Bond County came in at 3.1% today. Clinton at 9.8%. Madison's at 16.3%. Monroe's at 14.1%. Randolph County, 11%. St. Clair is 11.4%. And Washington County, 20.6%. Herb, it was a big day, and to see those doctors and nurses and medical staff stepping up and going on camera just so people could see them getting their vaccinations. It's really a good day and a great message to the community that the vaccines are here, and your turn, Team St. Clair, will be coming soon. And it's going to be imperative that we get this immunity into our community so that we can all get back to normal, to get back to doing the things that we like to do without having to worry about contracting this virus, our loved ones contracting the virus, or us giving this virus to someone. All those things, all those worries and stresses been playing on us for 279 days. The mental health in the community is important, and I think we ought to try to hook up with Dana Rosenzweig at some time and maybe talk with Dana about services that are available for people that are feeling the effects of COVID-19 and the emotional effects of that virus, which are significant. Even if you don't have COVID-19, it's creating a lot of other ills in the community.
Yes, it does. And, even though it's been a great day, like we've said here for the last half hour or so, watching those doctors and medical personnel step up and get the first vaccination here in the county, we can't forget, as Sam said earlier, we got a big holiday coming up with Christmas, so all of our guards have to be up. We have to stay vigilant to that. Statewide, 14,835 people have lost their lives to this virus, and here in St. Clair County, 294 people that won't have the opportunity to get this vaccine because it's been too late for them. I've seen a comment on her a while ago. Regardless of what we do, there's always a naysayer out there. Somebody saying, "Well, how do we know they was given the shot because they was covering it up?" So you're not going to rain on our parade today. We are all happy. The vaccine is here. We've been saying it's coming. It's here. The doctors did it today. We'll have them come on and maybe early next week and let you know if there was any side effects that they experienced. So believe me, they were getting the shot. They rolled up their sleeve, which I hope all of us do when the time comes available to us. My number that I'm watching is, you and I talk every day, down to 12% from 12.4. And as long as that regional positivity keeps going, now we got to work on the hospitalizations to get those two to come together. And then that light at the end of the tunnel is getting brighter. We talk about our businesses. We've got to continue to support them. Believe me, a lot of them call the EOC on a daily basis, or they're emailing us. Please support your local businesses as much as you can, because they're all suffering, and we got to do it.
There are so many positives that we can focus on. Spending time with the Flat Earth Society of people, I think, is really a waste now. I think we need to move ahead and encourage people to get out there and support our local businesses. This is a time of year that they would have made a lot of their profits for the year. So if you can buy certificates, if you can get out and go to the local businesses, the small businesses, and support them, certainly wear your mask, watch your social distance, and wash your hands, and make sure that everything cleanliness is abided by. Those are important ways to make sure that everything's going to be available once this is over. We now have a vaccine. We got a plan. We're going to head into a large level of immunity in the community, and over the next several months, we'll all be getting vaccinated. Everybody around this table will, and we're going to see this thing through. And at 3:30 in the afternoon, you're going to have to find something else to do. Because we will
see our face, our mask.
we will have moved on to another issue.
The one thing that I've been saying for the last few days is, with the gift season here upon us, just remember, if you follow what we've been preaching for 279 days, the best gift you can give your family, your neighbors, is not to give them the COVID virus. Believe me, they will thank you from the bottom of their heart. We'll be back with Daisy in just a few moments. And again, I want to just give a shout out to Daisy and Cindy and Tammy, the entire staff that works daily to bring these briefings to you, to keep you updated. So we'll be back with Daisy today to translate this into the Spanish communities. And then we'll be back tomorrow for day 280 with some more numbers. Have a good evening.
I was born and raised in East St. Louis, St. Clair County, City of Champion. We band together like family on picket, where the Mary Brown Center in Lincoln Park was my playground. Just as we were together then, we must all band together now and work to combat COVID-19. As an Olympian, I understand the importance of teamwork and overcoming hardship. So I plead with you to do what I'm doing to fight this virus. Wash your hands, wear your mask, watch your social distance. It takes teamwork, and if we stick together, we will victoriously cross